These are some simple shoulder exercises recommended by Prof. Singh following surgery or just before surgery. So it's pendular exercises where a patient leans forwards and rocks from the arm forward, backward, on sideways, as well as both clockwise and anti-clockwise rotations. This allows a maintaining passive range of movements. Following that, the active motion. This is the forward flexion, best done using a pulley or indeed a rope or a door frame could be used. Second method is using a stick. This generally involves some muscle firing of the operated arm. You do the extension using the same stick, pushing the operated arm backwards, and you can do forward flexion using the stick with use of the good arm to elevate the arm forwards. The external rotation is quite important, using a stick and the operated arm tucked in by the side. Internal rotation comes later on, but can be started as the patient feels comfortable without causing undue pain. Using a stick, or indeed the other method would be to using the unoperated arm, but this then puts pressure onto the operated arm and hence not recommended in the early stages, but perhaps could be used for later on. Lastly comes the abduction, which is only recommended further down, especially after surgery, as this can cause pain otherwise. So these are some gentle exercises which any patient with shoulder pain or any shoulder pathology can perform on their own. Thank you.